I affirm my personal and professional commitment to improve the oral health of the public, to advance the art and science of dental hygiene, and to promote high standards of quality care. I pledge continually to improve my profession, knowledge, and skills to render a full measure of service to each patient entrusted in my care, and to uphold the highest standards of professional competence and personal conduct in the interest of the dental hygiene profession and the public it serves. So this is the dental hygiene oath, and most classes choose to, kind of recite this when they do your guys' pinning ceremony. It's kind of a way to say, this is, what I've learned, and this is how my intention to practice is. So anyways, I hope that you guys choose to include it in yours. But it has some great statements that help us really focus on what our role as hygienists are. So when we talk about our profession, it's kind of always been a focus of preventative. I don't know if you guys remember this, but one of the very first lectures I ever gave you, so you probably don't remember it, but was when I talked to you guys about Alfred Phones. His idea initially was to have dental hygienists be in the schools and kind of be a preventative, almost school nurse type thing in the school setting, but we'd be focusing on oral health. So it's always kind of been the focus of prevention and health promotion. Throughout the evolution of our profession, there's been different emphasis and different things that have happened. We've gotten the ability to give local anesthesia in most states. We do different things. And now with COVID, there's been a whole focus on respiratory protection and that kind of thing. So it's definitely evolved, but just know that as hygienists, our main focus has always kind of been prevention and oral health promotion. Okay, I want you guys to think about the characteristics of a profession, meaning there could be, so there's the person who, say, checks out groceries at Walmart, and then there's us, okay? Now let's kind of go through these and think about the difference between the two different jobs, okay? A specialized body of knowledge and skill. So we definitely have something really specific. As a matter of fact, people who try to leave hygiene at some point find that they don't have a lot of other skills because it's so individualized to what we do. But you think about that, so does the person who's checking out groceries at Walmart. They have a specialized knowledge that they know how to do. Whoops, I apologize. An intensive academic course of study. That's definitely something that you guys are going through right now, and that somebody who's checking out groceries at Walmart does not have. One of my most things that gave me a self-esteem and a sense of pride was the fact that I made it through my hygiene program. And each and every one of you can feel that by making it through, because it's hard and it's a big deal to go through it and graduate. Standards of practice. We have standards that we'll address, further along in the year that say these are the standards and what we expect from hygienists. Self and group regulation. This means that if, part of this ethics course is knowing what's right and wrong and kind of regulating, saying, oh, this is not ethical, I'm not going to do it. Or if you see another hygienist who you feel like is not doing the standards that you think that a hygienist should practice, maybe they are, breaking the law and doing something that isn't okay, then as another hygienist, you would be expected to report that. External societal recognition. We all are grateful for the checker outer at Walmart, but, the society recognizes it a profession. They expect certain standards from us. There's a certain amount of, holding us to a higher standard, I guess. A code of ethics. We have our code of ethics that we're going to get into. We have an organized association. So we have the American Dental Hygienist Association. I don't know, is there a Walmart Checkerouter Association? I doubt it, but maybe. And a service ethic, meaning that we're trying to give back to others. So, if you really think about what stands somebody else out would be from just any profession would be this. And you could apply that to any of the professions, a lawyer, accountant, whatever. Okay. Patients expect professionalism from us. So they appreciate that we have a skill that we do, removing calculus, tartar, things like that. And we have knowledge. They expect that we use our critical thinking skills to help them solve their oral health problems, and caring. One of the things that you will find sometimes, what we do starts to become repetitive, right? But one thing that always will make your day as a hygienist is when you've established that relationship with the patient and they come and they ask for you, and they're sharing their life experiences with you and you've shared them with them. That's all kind of part of this caring part that really makes your job a positive experience. Okay, so as a hygienist, we have to go through several steps to become licensed, right? So one thing is to complete an accredited program. And in the second video, we're going to talk about a little bit about that accreditation process. We have to demonstrate knowledge, skill, and behavior. And that is all your clinical classes. You're demonstrating that you can pass that, right? We have to pass a written national board. Good luck. That's this coming up, right? And successfully pass state or regional or clinical exams. So that's your clinical board. Okay, so our healthcare providers standards and dental hygiene, we are regulated by a code of ethics. And by having that code of ethics, like I mentioned, that increases public trust. So here's a little quote by Josephson Institute. Ethics is about character and courage, and how we meet the challenge when doing the right thing will cost more than we want to pay. It's something deep to think about. Okay. The dental hygienist, we are a preventative oral health care professional. And so we already kind of mentioned this, that our goal is preventative focus. And so that's one of our number one things, whether we are in private practice or working more like in public health in a community setting. Professionalism. Professionalism is someone learned, publicly licensed, and supported by a collegial organization of peers committed to the ethic of service of clients of the public. So when we think about professionalism, basically what we're saying to the public is, we have these standards. You can trust us to have your best interest in mind, right? This is controlled by credentialing. So people feel like, oh, the hygienist has been through a school and they, had taught them certain things. And the credentialing process is saying, we made sure that they learned all these things in dental hygiene school. Okay. When we talk about professionalism, once again, this is kind of that relationship with us and society. And, society expects us to have excellence, humanism, and accountability. So we are, treat each person kindly, want the best for them. We want to be accountable for our actions, and then have altruism. So as far as models of professionalism, the dental hygiene or dental profession in general has kind of gone through a process over the years. So initially, dentistry was more of a commercial process where I'm going to sell this teeth cleaning and you expect this back, you're going to pay me money and you will get a teeth cleaning or whatever. You're going to pay money and you will get a sealant or whatever. So that's a commercial model of professionalism, a service for a good. A guild starts to be more like, and I have been trained and I know what's best and I'm going to tell you what's best for you. So as a hygienist, we're going to tell them sealants are the best thing for you. You should get them. Or a dentist would say, I know that a crown might be the best thing for this tooth or whatever. That's a guild model. Now, an interactive model is going back to patient-centered care. So if you remember what we talked about with patient-centered care, that's using not only your knowledge, but the patient's life experiences. You're going to use scientific evidence and also their circumstances, what is reasonable to expect from them or whatever. And together you come up with a treatment plan or game plan of how to act things. So that is a more of an interactive model. So obviously the highest standard thus far would be the interactive. That's where we want to be, is where we're treating patients as experts in their own lives and coming up with a game plan together. So interprofessionalism, this is relying on other healthcare professionals to come to work together to provide the best care for patients. And so far, medical has been very separated from dentistry, but the more that they're finding out the oral systemic link, they start to come more together. And my guess is over the course of your careers, over the next 20 years, we're going to see this a lot more come into play. Where, it might be you go to the OBGYN and they have a hygienist on staff to teach about things, or, talk about low birth weight babies or whatever. So that's one thing in our program that we're working on, is trying to get this set up better. Because what it does when we work with other healthcare providers is we start to understand and respect what their role in the health is, right? And we understand that communication is important to support each other in creating the best outcomes. And that way we have safe, efficient, equitable teamwork. Now that we are in the Paramount building, we really are going to start to work on that as far as working with maybe, say, respiratory therapists, and see there's a lot of information about microbes from the mouth getting in the lungs and things like that. So I'm excited to kind of see where that goes over the next couple of years. You guys have we're just trying to get you to pass at this point, but that's where we're headed. Okay, so that's the end of this one, and we'll do part 2 next.